Hi everyone, it's Kathy with Medicare Quick, and what I'd like to do is show you one of the neat tricks that my office uses in order to find our clients the least expensive drug plan. So we're going to switch over to my computer screen. Let's get that recording. And it's going to record here in a second. Okay, so what we're going to do is we're going to go to the Medicare.gov website. So that's www.medicare.gov. And then we're hovering over this drug coverage Part D, and we're going to hover over Find Health and Drug Plans, and then we're going to click on it. Now, right now during annual enrollment period, they make it a little bit difficult because they have this enroll in a Medicare plan. So we're going to get out of that area and click on Home, and then it takes us to where we want to go. So we're going to go ahead and type in a zip code, and for this purpose I'm going to use this zip code. And then you're going to note how you normally get your Medicare coverage. We usually just put original Medicare, and unless you know for sure that you get extra help, we're going to put I don't get any extra help. You can input something different on your drug search. So now what we're going to do is we're just going to enter all of the drugs. Now, some people only have one drug, some people have a list of 20 drugs. I'm just going to enter 3 drugs. So as you can see, once you start typing in the letters, it's going to pull up a list of drugs. For this purpose, I don't have an actual list that I'm looking for, so again, I'm just going to make some things up. So we're going to say that we take 10 milligrams of Abilify and we get a refill 30 pills a month. And for this purpose, we're going to use the brand name drug, but if you're able to use the generic, then go ahead and put that in, or let us know when you're giving us your drug list, because the generics are a lot less expensive. So we're going to put in a second drug. Again, I'm just making these drugs up, and let's say that we're going to use this one, and we're going to say we get 1 package every month. And then the last drug, we're just going to type in, and so we'll say that it's this drug, and by the way, I have no idea what these drugs are, I'm just making these up. And so we're going to add that. And so this is going to be our, as soon as it pulls it up, it's going to be our complete drug list. So we're going to click My Drug List is Complete. And then it spins a little while. Okay, so now we get to pick our pharmacies. Now, we always tell you to give us 2 pharmacies that you're willing to use. We're not going to search all of the pharmacies in the world near your house, but I'm going to show you how you can see if the pharmacies that you have selected are the right ones for the plans that we come up with. So let's show you how to do this. So let's say that you go to Loyola Pharmacy and let's say CVS on Sepulveda. So we're pulling up those 2 pharmacies, and then we're going to continue to the plan results. It takes a little while sometimes for it to pull up the information. So you just have to be patient during this time period while it pulls up all of the plans. So at this zip code, there are 25 plans available. And right now we're just looking at prescription drug plans. So we're going to select this one, and we're going to continue to the plan results. And again, it takes a little while. It's the Medicare.gov website. There's nothing that I can do about that. So we just sit here and wait patiently while it spins and does its thing and tries to find the least expensive drug plan based on the drugs that we've entered. Now the website will only allow you to enter 25 medications. So if you have more than that, it's a little bit more difficult. Okay, so now we've gotten to the point where we found the drug plans. And what we always do in our office is we sort it by lowest estimated annual retail drug price. Now, if you were doing this in the middle of the year, let's say you have a special election period, you're turning 65, you're moving, whatever reason, it'll sort at this point from now until the end of the year. But because we're doing this during annual enrollment period, it will give us the amount that you'll spend for the entire year. So for this particular list of drugs, we're going to, it sorts these in order of price. And so unless you have an aversion regarding the star rating, so my office will usually just select the top 3 because those are going to be the least expensive. But if you want to start at a particular star rating, Medicare rates its drug plans and its Medicare Advantage plans by the star rating. There's a total of 4. So for example, if you only wanted 3 stars or higher or 4 stars or higher, then you would let us know that. Otherwise, we're just going to sort the top 3. And to find the star ratings, you just go right here. So you see this star rating. So this one is 2.5 stars. This is 2.5 stars. And this last one is 3.5 stars. So we're going to compare the plans. We're going to click on this box here. And again, you have to have a lot of patience when you do this. This is one of the reasons why my office offers this as a service to our existing clients or to people who would like to become a client. Okay, so now we're sorting them. Here's the Symphonics Value Plan, the Blue Shield Medicare Enhanced Plan, and the Symphonics Prime Saver Plan. Now, do you see this fixed cost, the monthly drug plan premium? We don't even look at that because that's not what is expensive. What's expensive down here is the estimate of what you will pay for drug plan premium and drug costs. Now, this person is not going to want to shop at Loyola Pharmacy. And here's why. If they shop there with this first drug plan, they're going to have to pay $20,004.72 a year for their drugs and their drug plan. These figures include the drug plan and the drugs. So if they shop at CVS, it's only $3,689.05. So your pharmacy matters. It matters a lot. So what we would do at this point is we would normally ask the client, hey, do you want to select one more pharmacy? So what I'm going to do is show you how to do that. So we're going to go back to select your pharmacies. And we're going to watch it spin and let it do its thing. Sometimes at this point the system crashes, so I just need to warn you of that. Hopefully it's not going to crash during this video. Okay, so we're going to remove Loyola Pharmacy from this list, and we're going to select another pharmacy. Now, as you can see, this particular list is only going a half a mile from your house or from that zip code. You might not find the pharmacy that you want. Let's say you want a national brand. So let's increase it. Let's increase it to 4 miles. And what I'm looking for is I'm looking to add, at this point, another national brand. So I'm looking for either Costco or Walmart. So here's Costco. So what I'm going to actually do is I'm going to leave CVS up, but I'm going to add Costco as a pharmacy. Now, it's not always, for those of you who are Costco members, it's not always the least expensive place to buy your medication. So it's always a good idea to double check, to look on the website, the Medicare.gov website, to see what your estimated costs are going to be. Okay, so it's still spinning. Okay, so we are still looking for the prescription drug plan, so I'm going to continue to plan results and let it do its magic. Dum 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 dum. Okay, so it looks like it came up with the three, still the three, well actually no, it changed it a little bit. So now instead of having 2 Symphonics accounts, it's got 1 Symphonics and 2 Blue Shield plans. So let's see what happens. We're going to go ahead and click Compare Plans. And we'll take a look again to see what everything looks like. Sometimes you just have to play around a little bit. Now, we can't always, look for everything to be perfect because during annual enrollment period we're super busy. But once we give you your drug plan spreadsheet, you can go on the website and you can do some sleuthing, and I'll show you how to do that. Okay, so we've got this plan, and again, we don't even bother to look at the monthly premiums. What we're looking at are these numbers. So with this particular plan in column 1, so we're looking at these columns. This particular one, if we shop at CVS, this is the least expensive plan. If we shop at Costco, this is the least expensive plan. And if we get our drugs via mail order, this is the least so it's all this one. So if we were working with you, we would recommend that you take this plan. Now, that's the case for us whether we represent that plan or not. So we're always going to indicate to you which are the 3 least expensive plans based on the information that you give us. And if it's a plan we don't represent, we're still going to tell you, because as you can see from this tutorial, it can make a big difference in the amount of money that you're going to spend. And we do get paid if we enroll you in a drug plan, but it's not that much money. Okay, so now let's look at some other information. So you're going to spend, with this plan, if you shop at CVS or if you shop at Costco, it's roughly the same amount of money. Okay, so let's see what the drug plan is going to spend. So the drug plan, the total costs are actually going to be this amount. So that's a lot that your insurance company is paying, as well as what you are paying. So this is going to show you that this plan has a deductible, and you're going to meet it in the first month. You're going to reach the donut hole in month 3, and then you're going to reach catastrophic coverage in month 6. Partly because of the cost, your tier levels. So this drug is a tier 5, and that's one of the reasons why it's so expensive. This drug requires prior authorization. So let's go ahead and click on this, and you can take a look to see what this information is. So you can see what does prior authorization mean. The definition is going to be in here. And let's look to see what quantity limits mean, or what the quantity limits are. So you're only going to be able to get 30 tablets of this particular drug every 30 days. So that's what that means. Okay, now let's take a look to see now this is what I was telling you about. If you want to see if the plan that you're selecting, if you're selecting the right pharmacy, you go to this area where it says pharmacy and mail order information, and you click on the network pharmacies, and you see if there's a preferred pharmacy in your area, because usually if you see a pharmacy that says preferred, it's going to be less expensive. So for this particular plan, it looks like both CVS and Costco are preferred pharmacies. Now, if you went to Emerson Pharmacy, they would accept the plan, but your costs are going to be higher because it's a non-preferred, it's a standard pharmacy under this particular plan. Same thing with, I guess it's IV med services. They're accepted, but they're non-preferred. Plaza West is the same thing, and you can read all that. So you're always going to want to go to a preferred pharmacy if you can, because of the price structure. Okay, now let's see what happens if we change this drug to a generic, because it can save you a lot of money. So this is already generic, and this one, there is no generic. So let's change this. We're going to click on that, and now we've changed it to the generic version. So let's see what happens to our pricing. Let's see here. What I'm looking for is to see if it made the changes all the way through. So it does look like it changed the pricing a little bit. So what we would do if we changed to generic though, is we would go back to the plan results and we'd redo the comparison, because that can matter as well. So let's take a look to see if the generic version, if you can find a lesser expensive, yeah, see how that changed? Now we have Cigna, Symphonics, and Cigna. So do you see how that matters? That's why when we ask you for your drug list and your pharmacy, you want to make sure that you give it to us in the manner that we're asking, because it can make a big difference in the amount of money that you're going to spend. Okay. So now it looks like, let's see here. It looks like if you're going to buy at CVS, this is the least expensive one. If you're going to buy at Costco, this is the least expensive one. And if you are going to do mail order, this one. So it's between the first and second. So it's either going to be Cigna or Symphonics. And currently, we don't represent either of these companies, but that doesn't mean that we wouldn't send this list to you as is, because our goal is to help our clients get the least expensive drug plan, because it can make so much difference in the amount of money that you spend. So then all we do is we create a little PDF and we email it to you. So I'm going to go ahead and save this. So we usually will just email that to you. Now, I'm going to show you something really cool about this drug list that we send you. You can use this to go online and to see all the information that we typed in. If something changes, you can go in and change it yourself. So how do you do that? It's this really cool thing right here called the drug list ID. This drug list ID and the password date and the zip code. You're going to want to save that so that you can go online again. So I'm just going to save this, copy. And now what I'm going to do is I'm going to pretend like I'm starting over. So now here I am. I'm at the Medicare.gov website, brand new. My drug list isn't in here, right? So we're going to go to drug coverage. We're going to go to find health and drug plans. And now what I'm going to do, just give me a second here. Now remember, during AEP, sometimes you're going to get this. So we're going to click on this little home button, so that, because we're not enrolling in a plan, we're just doing research. Okay, let's see, where did it go? Okay, now this time I'm going to type in a different zip code. Okay, so let's pretend like you've moved. So I'm going to type in 997, let's see, I'm sorry. Shoot, what zip code was I trying to, we'll do 92078, okay. 92078, so we've changed zip codes, so let's see what happens if we type in the wrong zip code. So still, I'm going to say that we're original Medicare, and I don't get extra help. And now we're going to continue to the plan results. Okay, now do I want to type in all those medications again? No, especially if I've typed in 20 drugs. So what I'm going to do is I'm going to type in that drug list ID and the password date. Now, I'm doing this today, so it's already going to be in there. But if the password was a different date, you'd type that in, even if it was 2 years ago. So we're going to retrieve that drug list. And look, wait, something went wrong. Let's see what happened. sometimes it does that. So I would try again. Don't be discouraged. Sometimes the Medicare.gov website does weird things. Okay, now do you see how it says change zip code of drug list ID? So we're going to go ahead and change the zip code. And what will happen too is now, because we changed the zip code from a Los Angeles zip code to a San Diego zip code, now we're going to have to choose different pharmacies. But let me show you what happens. So we're just going to go ahead and choose CVS and let's say Ralph's. And let's see what it looks like after we've done that. Okay, so we're going to look for the prescription drug plans and see if it made a huge difference in the pricing. So look, it's still, well, now it's 3 different ones. So do you see how everything that we ask you to give us matters? And we're not going to do the thinking for you. We're just going to create the drug list. We really don't get paid to do this. Like I said, we do this as a value add. Even if you enroll in a drug plan with us, it really does not pay for our time to do this. So once we get your drug plan in, if you want to make changes to it and you're not our client, if you're not taking another plan, say a Medicare supplement plan with us or Medicare Advantage plan, then I'm showing you how to do this so you can make the changes yourself. So we've clicked the top 3 because it only allows you to sort 3. So now we're going to compare plans. It only allows you to compare 3 plans. Okay, so it's connecting. And hopefully we'll be able to edit out all this waiting time, but maybe not. Okay, so now we've got our 3 top drug plans. Again, I don't look at the monthly cost because that's not your big expense. We're going to look at this cost here. So for these 3, if you purchase at CVS, then the least expensive plan is this first one. If you purchase at Ralph's, then this is your least expensive plan. And if you do mail order, then it's this one. Okay? So that is how that works. And this will tell you, is there a deductible? Is there not a deductible? When are you going to reach your deductible? When are you going to reach the donut hole? When are you going to reach catastrophic coverage? And do you have drugs that are not on formulary? So what does this mean, step therapy? What step therapy means is that they're going to try you out first on a lesser expensive drug. And if that doesn't work, then we're going to have you go to a different drug. And when I say less expensive, that's not always the case. But you get the idea. They're going to start you with one, and they're going to move you up to different drugs to see if those work first. And if step therapy doesn't work for you, or you can always work with your doctor to get an exception. Okay, so we talked about that. We've talked about prior authorization. Your doctor has to work with the plan in order to get that drug covered for one reason or another. So you can click to if there's nothing, something in there that you don't understand, you can click on it and it'll explain it to you. And then you can also make sure that the pharmacies that you've selected are the preferred pharmacies. So look here, look, CVS on this plan is actually not a preferred pharmacy. That's probably why it wasn't the least expensive for CVS. Now if you wanted to see another pharmacy in the area, so we could try to see if Save-On would be less expensive. So we could remove CVS, and again, my office is not going to do all of this because we just plain and simple don't have time. But you can do this if you want to fully see what plan is, if you're really interested in seeing what plan is going to save you the most money, you could do all this on your own time. So we're going to add, let's say, Save-On. and then we'll see if that makes any difference. Okay, so now we have our 2 pharmacies, and we're going to close the window. And in order to see if that made a difference, we have to go back to the plan results. And it did not make a difference. So there you have it. I've shown you how to do the search on the internet to find the least expensive drug, or I'm sorry, drug plan. I've shown you how to see if you're going to the right pharmacies. I've shown you how to see if a generic will save you money or not. We've talked about step therapy. We've talked about prior authorization. And I've shown you how to look at the spreadsheet that I've shown you, where you're going to meet the deductible, where you're going to reach the donut hole, and all of the other things that can help save you money when you are looking for the plan. So thank you so much. This is Kathe Kline with Medicare Quick, and if you have any questions, feel free to post them in the comments, or you can send us an email or call. Thanks again.